Yeah, very good evening to all of you. And I am Dr. Vaibhav. I'm practicing in Mumbai. So let's start with my topic of presentation. For basal implants, anchorage in the floor of nose, palatal bone, canine pillar, and management of incisive canal. Cortico-basal implants. So cortico-basal implants is boom for us because it provides us, we can engage varieties of areas. About firstly nasal floor encouragement. So when we talk about anchorage in nasal floor, all know nasal floor provides good quality of bone, good cortical, dense cortical. Even in atrophic maxilla, we can place implant easily and we can give good result to patients. Now we can talk about techniques, the most important thing, techniques. So there is not a single technique to engage nasal floor. There are multiple techniques to engage nasal floor. What is depend on the techniques? The jaw quality, the position of the jaw. If there is a patient has protrude maxilla, the techniques are different. If retruded maxilla, the technique is different. How the technique is different? If patient has maxillary protrusion, so you want a good aesthetics. So you can't place the implants buccally. You have to place implant from the palatal area and you can go and engage the nasal floor. If the maxilla is retruded, then definitely you have to start your implant placing from buccal area and engage the nasal floor. So you can provide the good aesthetic to the patient. So even in the thin ridge, I have done very thin ridge in maxilla. So what to do? You can't place from the buccal area because it can expose your implant, even your shaft. So definitely you go slide palatally and engage straight to this nasal floor. So there are so many techniques, it totally depends on the quality of jawbone and the position of jaw. So in my presentation, I am adding some my cases on nasal floor. So this is the cases, segmental cases. Patients has this position, there is a radicular cyst. We open the flap, first enucleated the cyst, and immediately place this mono implant beautifully, and we got super talk here, and super overjet is maintained, overbite is maintained, and second case, patients wants good looking teeth immediately within 2 days, and cortico-basal implants make this possible. Immediately we remove the teeth. This is the OPG. See the CBCT, we got good encouragement in nasal floor, and we have given zirconia. Patient application. Third case, single implant placement, as sir says, and that we can take good quality of tooth with basal implant. So here I extract and got nasal floor encouragement and attach the prosthesis with once central incisor. Now we talk about canine pillar and palatal bone afterwards. So for canine, about anatomy. So canine pillar is lies just anterior to the canine pillar. There is a nasal cavity. Posterior to the canine pillar, there is a maxillary sinus. So you can find in edentulous patient, you have to find, you can easily find the canine pillar. You can feel it and place the implant in the canine pillar, just superiorly and slide palatally backward. How do we get placement in palatal bone? So why we encourage palatal bone first? Because in posterior maxilla, there is a less vertical height. So now I am going to show some cases of mine which consist of canine pillar or it is a full mouth cases. So this is an advanced periodontal condition. The OPG, pre-op OPG, and we placed beautifully, we placed 12 implants in maxilla and 10 implants in mandible. We get good engagement in nasal floor, canine pillar, even palatal bone. Everything is good. Patient is very happy. Now, this is a beautiful case. What I am telling, the technique of nasal floor. So in this case, you can see clearly see how much maxilla is protruded, how much coming smile as patients. And this is the condition, full periodontal problem. We engaged this area and we still left that molar because that is very rigid. So we didn't remove that. Look. Now, last segment of incisive canal. So, incisive canal, there are two techniques to care for incisive canal. First, you can locate that incisive canal. There's a bulbous fold just behind the central incisor. You can feel it and place the implant slight far away from that area, because that is very vascular area. Nasopalatal artery nerve is there, sphenopalatal artery is there. If you puncture that area, there is so much bleeding, patient has been pain. So definitely you have to feel that area and place the implant slight far away from that area. If you can't able to do that, then take a CBCT, plan your treatment plan, and then you can place the implant. So it lies just beside the central incisor from the nerve. So this is the failure case which I corrected through KC implants. So it is far away from 0.3, then patient is very comfortable and I am also comfortable. So these are the cases, and I have given prosthesis. So this is my clinic, and I am using Swiss implants, which is mono implants. And thank you so much. Thank you so much for Viren sir, because I am very fortunate to find him, because I am practicing since 2019, but I didn't know about sir. And now I am very fortunate to having our mentor Dr. Sir, because I got so much learning from him, and my batchmates, very happening family I got from here, very beautiful memories we made here in our all the sessions. So thank you so much all the guys, and thank you so much mentors. Thank you so much.